Hi, we're here in Houston at the 2024 SITC annual meeting, and we're presenting data from our NCI-sponsored national clinical trial E3611 conducted by ECOG Akron, and where we tested combination immunotherapy with CTLA-4 blockade and interferon alpha in patients with advanced melanoma. With regard to the background, interferon alpha favors Th1 shift in immunity, including the augmentation of cellular numbers and effector polarization of host response to tumor. It also has a direct effect in inhibiting tumor proliferation, angiogenesis, and STAT3. Combining with CTLA-4 blockade may actually downregulate CTLA-4-mediated suppressive elements. E3611 was a 2x2 factorial design study that tested ipilimumab at 3 or 10 milligram per kilogram alone or in combination with interferon alpha. The primary endpoint was progression-free survival, and this report summarizes the latest clinical data as well as biomarker data designed to gain insights into the underlying mechanisms. In terms of the laboratory methods, we utilized multiplex immunofluorescence panels to determine the frequency of various phenotypic cellular subsets using combinations of markers. The tested panels included tumor immune cell profiling, CD8 T cell profiling, and immune cell suppressive elements. We tested the association of those immune-related biomarkers with a degree of clinical benefit. Overall, 79 patients were included in this analysis that were randomized into the 4 treatment arms. And we learned that the addition of interferon alpha and a higher dose of ipilimumab are associated with increased progression-free survival. Importantly, when looking at the Kaplan-Meier curves and the blue line and the red line here, these are arm A, which is high-dose interferon plus ipilimumab at 10 milligram per kilogram, as compared to the standard of care ipilimumab at 3 milligram per kilogram. There was a significant improvement in progression-free survival in favor of the combination. Now, mechanistically, low CD11b near tumor cells and high PD-L1 were associated with improved progression-free survival, as shown in these Kaplan-Meier curves, and these are representative immunofluorescence images for these 2 markers below cutoff and above cutoff. Next, the expression of HLA-DR in CD3 positive T cells and expression of IDO were associated with improved overall survival, as shown here in these curves and these representative images. Very interesting as well was that a high CD163 expression, a marker of M2 macrophages near tumor cells, was significantly associated with decreased progression-free survival and overall survival, as shown here in the Kaplan-Meier curves and these representative images. Overall, I think it was interesting to see that high-dose interferon plus ipilimumab at 10 milligram per kilogram improved the progression-free survival compared to the standard of care dose of ipilimumab at 3 milligram per kilogram, which may have a role in the salvage setting in melanoma and possibly warrants further investigation. The biomarker testing gave us some interesting insights into interferon myeloid cell crosstalk, and ongoing analysis, we are testing markers of ER stress in T cells and myeloid cells. And we'll update these results at an upcoming meeting. Thank you.